The current classification includes 4 phenotypes with a large heterogeneity of the symptoms of the disease. And on the one end of the spectrum, we have the more severely affected infants, the SMA type 1 patients with a heavy involvement of the of ventilation, of the phrenic innervated muscles. And on the other hand, of the spectrum, we have patients with a SMA type 3 or type 4 with a minor involvement of the muscles of the extremities. But especially in the SMA type 3, there is a large heterogeneity. We have patients that lose their status of ambulation within their first years of life. And on the other hand, we have some patients who are still able to walk within their 40s. So there is a large heterogeneity. But in the last years, we doubt the existence of a SMA type 4, because when you ask these SMA type 4 patients which you may think of if they have their involvement after reaching adulthood, you can see that there are always minor symptoms within their adolescence years. So I think that the patients that are now classified as SMA type 4, these are minor forms of SMA type 3. The spectrum of the disease is a large heterogeneity of the severity of the disease, with a severely impaired patients with early problems with ventilation, who need mechanical ventilation within their first years of life. And the other end of the spectrum are patients with only minor involvement of the extremities who have probably only minor problems when climbing stairs or something like that. And this is the spectrum of the disease.